We ready? Okay, sorry if you attended the previous Google chat and found that the sound wasn't working very well and other potential technical difficulties, but we regrouped and reconnected, and I think we got it now. So for those of you that aren't aware, the new Healing Fungal and Parasite Infections, the Absolute Essentials program I've just released is out today. You can order it from the website now. I've got a bunch of questions sent in that I'm going to give some answers to for a half an hour, and I'll answer as many as I can. Some of them are very long and lengthy and complex and include almost whole life stories. So I will try to skip through and just find the key points that are relevant to the discussion. I'll preface our topic, our discussion tonight with these questions and answers with saying that many of the answers to these questions require a fairly comprehensive assessment and require more information than I could possibly cover in a short period of time like this. So my goal is to either refer you to the program where it has the more comprehensive answer, or resources where you can get an answer so that I can be more efficient. The first question is from Caleb. Have you seen a correlation between fungus and parasites and skin diseases such as chronic acne or boils? If so, how do you treat these conditions? Yes, there's a definite correlation. A wide variety of skin problems with different diagnoses, in my observation, are just the different appearances of problems created by a fungal infection. And the fungus, has no problem eating up the skin and does it very, very commonly. Acne is a common result of too much toxicity in the body. The skin is an organ of detoxification, and almost anybody that has a fungal or parasite infection at large has a toxic body, or a body that's too toxic for optimal function, and which may be one of the reasons why they got the infection or can't get rid of it. Boils are often the body pushing toxins out of the body for the body's own protection. If the body cannot dispose of the poison through its normal pathways of detoxification, but the body stores things in fat. But if things are toxic enough, the body wants to push it out, and sometimes tries, and a boil is an example of that. A boil is really like an externally seen abscess, which is nasty. Okay, next question from David. In regards to checking symptoms, what are some of the common side effects of detoxifying or killing off parasites? The answer to that is any symptom that you have can get worse in the detoxification and or die-off process. So if you had headaches, they can get worse. If you had aching necks and backs, they can get worse. In fact, many people not realizing that these are classic detox or die-off symptoms think the program isn't working and stop, instead of getting guidance from whoever's coaching them on how to go through the process. But the most important thing you can do is study a course like mine and get enough knowledge to make intelligent decisions, so you know how to manage die-off and detox. But as a general rule of thumb, if the detox or die-off is causing discomfort and or is threatening one's physiology to the point that the risk is outweighing the reward, then an intelligent decision has to be made as to how much to back off and for how long to back off, and what sort of periodization may be involved in a back off scheme, such as what herbs should be used, what drugs, if you're working with a physician, should or shouldn't be used, how much of them, should they be cycled, etc. Next is from Diane. I won't try to say her name because last time I tortured it. What is the danger of parasite die-off, and is it important to get tested before taking a parasite protocol to know what type of parasites or funguses one might be dealing with? Well, I just described the die-off, so that's done. There's different camps out there. There's doctors and therapists that believe that you should get tested before you do anything. There's some that believe that doing general parasite protocols is dangerous because it can force the bugs deeper into you. Like any topic, you're always going to have people on both sides of the fence. My personal approach from lots of experience over the years and working with many different people is that, one, because they only test for a small number of parasites compared to the number that can infect human beings, about 1,000 different parasites infect human beings, and you might get some of these electronic systems that might be doing electrical testing, impedance testing for maybe 150 or so different parasites, but many of the blood testing companies test for significantly smaller numbers. So it's very common for people to have many negative tests, yet still clearly have parasite symptomatology, and the only approach is to begin treating them and to do some of the things I teach for more specific fine-tuning of your approach to identify which parasite it is. So you need to know life cycles, you need to know symptom profiles, and then you need to know where to look. And I talk about that in the program. So, should you get tested? Well, you can get tested, yes. It's a good idea if you can afford the test or the testing. Oftentimes you have to do multiple tests for a wide variety of reasons and at multiple times. If you can't afford the test, or you get tested and you're negative but you're still having symptoms, or you test positive and you follow the protocol and some symptoms go away but you still have more symptoms or symptoms worsen, then you're still right back to square one. You still have a potential problem in not knowing what to do about it. The difference with my program is that I show you the many other factors that aren't picked up on a test, that have a massive influence on whether or not you're likely to get better on any protocol, and whether or not you're potentially making mistakes that are significant that will result in no medicine being able to work for the long run. These are real issues. In general, I think testing is a very good idea, but I can just tell you that probably 50% of the people that I work with have been tested negative several times, and I had to take the protocol approach that I share in the program. When in test, why? When you can get a test, why not? Data is useful. It's better to have and not need than to need and not have. So whenever you can get a good test result, you got something. Okay. This one says, Paul, I have a question about the Sputnik for parasites. Have you heard of the device? If so, what are your thoughts on it? I don't remember the Sputnik in particular. I'm kind of getting the feeling it might be one of the Hulda Clark zapping type devices. There's many devices out there, but for the reasons I share in my program, the devices are no more effective in the long run than most of the other protocols, because if you're making the mistakes that most people do that I talk about in my program, which are many, you'll just be zapping yourself till you have seizures and can no longer shut off the zapper. And maybe we can get you on YouTube and you'll get rich but never know about it. So yeah, there's all sorts of gadgets out there, just like there is for everything, but that doesn't mean they're working. I have heard from people that some of those things have helped them, though, so I'm not saying they're no good. I'm just saying they won't work if you don't do the other things. Next is Mered. She says, if both parents have a parasite, are their children likely to have it also? Yes, absolutely. If anyone gets infected with a parasite infection, A fungal infection, it's not so much the same issue. I mean, you could be sleeping with someone that has a fungal infection on their skin, or for example, on their scalp or their athlete's foot, and not get it. But if you have a parasite, most parasites, I don't know any of them that this isn't the case, but parasites are very, very skilled at adapting and moving through their environment, and they know how to use fluids to get almost anywhere they want, and many other little tricks. So if you have a parasite infection and you're in a relationship, or you have children, or you live in close proximity to anyone, for example, if you were in the Army and you were in a barracks with 50 guys and you had, you know, a blastocystis hominis or cryptosporidium or one of these common parasite infection, you could give it to everybody in that barracks. That's the truth. So always, and also if pets have parasites, it's not uncommon for people to get parasites from their pets. So the worm parasites are the ones that I see the most common, causing problems in animals that also get into human beings. But there's other ones like Toxocara and other parasites that can transfer from animals to human beings. So if you've got parasite infection and you're not sure whether or not your dog has one, or your cat, or your turtle, or your minor bird, you should have somebody at a veterinary office assess that for you and get that taken care of, especially an animal that lays on the same carpet. You know, how many people let their animals lick them and all sorts of neat stuff. So that's a death sentence for bug swapping. So anyone has it, the whole house has it. Okay. This is, excuse me. This question comes from Pete in Sweden. He's asking, first off, some of these questions are very long and complex, so I have to kind of, edit out. He's asking if the loss of smell and taste could be a result of a fungal infection. When it comes to fungal infections and parasite infections, just remember, anything's possible. When you look at the literature and the symptoms attributed to these different parasites in the literature, if you were to add them all up, it's everything. Anything can come from them, pretty much. So never rule it out. But loss of smell and taste are more classically indicators of a neurological problem. So that would be the domain of an ear, nose, and throat specialist right there, who would then probably send you to a neurologist. Next, he says, from your experience, is chronic prostatitis or chronic epididymitis a result of a parasite infection? Many chronic skin conditions are the results of fungal infections. I've seen severe cases of psoriasis completely and utterly disappear. I mean, whole body covered with the stuff and gross, completely disappear within as little as 3 months, following exactly what was in my book, How to Eat, Move, and Be Healthy, and the suggestions I share in the program. Many cases like that. Prostatitis, Doug Kaufman makes mention of his research, I think, and observations in his second book. I believe the title is Cancer, and he shows that there is a correlation between fungal mycotoxins and prostate-specific antigen. It's been a long time since I read it, so I can't remember the exact technical details of the link, but there is one. And I've treated lots of people over the years and know for sure from my experience that fungal infections can cause benign prostate hypertrophy and prostate problems. So my approach to any male that has a prostate problem of any type is immediately to put them on an antifungal diet, and it almost always gives some kind of noticeable relief. Okay. Now he's talking about what he's doing to get better from some of these problems. Antibiotics won't work. And then he says the magic statement. I'm pretty sure the root cause of it is stress. And I'm working on that as well. Stress is the #1 thing that weakens your immune system and opens the door wide for fungal infections and parasite infections. Stress is a word that encompasses the mismanagement of self in any direction. So if you mismanage yourself in regard to nutrition, hydration, sleep, breathing, thinking, or movement, you accumulate stress in accordance with the number of mismanaging acts you make, the frequency of them, and the number of factors you're mismanaging. So if you mismanage water regularly and you do it badly, you're in trouble. If you mismanage water, sleep, and movement, and food, you're already in a lot of trouble, even if you do those irregularly, because there's too many of them. It's too many insults to the system, and your vitality will drop down. Basically, just remember this rule. On a 7 out of 10 scale, 10 being supreme vitality, a healthy, strong, vital human being, like my wife, she's raising her hands. I'll take it. Careful what you tell me. You know, I've got ways of testing these things, young lady. You know, gotta live, right? So anyhow, I forgot where I was at when my wife got my attention there. But so stress is critical to manage, and I talk a lot about that and give you many, many real clear, logical ways of looking at your own life to identify how you're getting all these problems. You know, of all the parasite cases I've ever treated in my life, which I don't know, maybe 150, something like that. I've never seen but maybe 5 people whose parasite infections were not directly related to lifestyle mistakes that could easily be managed. It's almost always ignorance of how a human body works and how to care for one, or addiction, or a lack of awareness of an underlying pathology, like too much mercury in your body, fillings in your teeth poisoning your body, a bacterial dysbiosis that's not diagnosed, or other factors like that. There's almost always some kind of lifestyle component of significance and stressor of significance at the psychological level, one or both or any combination, which is why I put so much emphasis on that in the program, to really show you how these things happen. And I also do a fair bit in there, which I don't think I've never seen a lecture like this, but I show you the benefits of parasites and how they work as part of our life and life cycle, and you know what their function is in nature, and how to have a more intelligent approach to parasites and just kill the little buggers, because that doesn't work very well. You just do that over and over again. It's like you know, stepping on ants to try to get them out of your house. Have you ever seen that work? I haven't. Just doesn't work. Okay. This one's from Donna. She says, I have suffered from she gives me the technical name for dandruff. I have suffered for years from dandruff. I have been told this is caused by a fungal infection. It is. Dandruff is a fungal infection. So just to remind you, your classic fungal infections are dandruff, jock itch, athlete's foot, toenail fungus, fingernail fungus, vaginal yeast infection, and then you can get candida, quite commonly in the mouth, where you can see white specks on the tongue and even on the gums. And never kiss someone with that unless you already have it and don't care. Okay? Never kiss people that have parasite infections unless you're healthy enough to deal with it. Where was I, Penny? Dandruff, that's right. the dandruff question. Okay, so she says, I have tried everything under the sun to get rid of it, but nothing I've tried works. That's exactly why I built this program, because that's, I guarantee you, when you study my program, Donna, you will see there's many things under the sun that you haven't tried, and you will learn a lot of neat things. But nothing works. I even tried an elimination diet for 6 weeks, cutting out all dairy, sugars, and grains. Unfortunately, that didn't work. Well, there's many technicalities to those things. To do those things correctly, they're not just that simple. If you've tried these things, my advice would be to get a holistic lifestyle coach, a Chek holistic lifestyle coach at level 2 or 3 to manage you and guide you, and you probably will be fine. But the immediate answer is to study my program and follow that program, because I can promise you, you're going to find, I would be willing to bet a cup of coffee that, tea for me, coffee messes me up now, you're going to find lots of things that you can do that would be significant. And you're bringing up my memory to tell everyone that, listen very carefully, boys and girls. There's something I need to share with you all. Symptoms like palpitating chest, digestive trouble, joint pathology, symptoms at large are late stage indicators of disease. There's several stages before symptoms show up in chronic diseases. And symptoms mean, at many times, when you look at the scale of the different stages of tissue change and all the things involved in the creation of a disease, symptoms actually happen to show up very close to death itself. There's 4 phases, steps before physical symptoms like that hurt shows up. So if your body has been running along just teetering like Humpty Dumpty sitting on top of a wall, and all of a sudden you get yourself a parasite infection, that can push Humpty Dumpty not only off the wall, but now you've got an additional burden on your physiology, which burdens your psychology, and you don't have the reserves to recover from it. And most people don't realize that some of the herbs and protocols you got to do to kill parasites are stressful to your body. This is strong stuff. It kills bugs. I mean, imagine if it knocks bugs out, and they're tough, it's got to be pretty strong on the old body. So if you don't manage yourself very carefully, and you don't understand that something as innocuous as mercury amalgam fillings in your mouth that you haven't thought about for 12, 14 years can be poisoning your body. For example, if you bite down on a typical mercury filling one time, research shows it releases enough mercury that if it was put into a pond about 4 acres square and measured by the Environmental Protection Agency, they would have to quarantine the pond. You get that out of every bite. I've seen people who had mercury amalgam fillings through their whole mouth. What's my point? You can be going along with your beautiful smile and your nicely filled teeth full of mercury, not knowing that you're got all sorts of trouble brewing inside of you. Get yourself a parasite infection, do all sorts of cleanses, and end up coming to a guy like me paying a huge amount of money and me saying, let me look inside of your mouth, and oh my God, I see a lead mine in there with mercury on the top of the cake, and you're wondering why you're not recovering from these fungal and parasite infections. If your vitality drops below a 7 on a 10 scale, 10 being Superman, 0 being not even discussing, 3 being death, 7 being the threshold of vitality. If you cross the threshold of about a 7 out of 10, you typically start seeing fungal infections occur. If you drop much lower than that, once you get a fungal infection, you open the door wide for a parasite infection, because funguses use chemical regulators as mycotoxins to modulate your immune system, trick it, and confuse it. Then you're pretty much naked when you're out there in the world of parasites in most instances. So you've got to look at the fact that in order to properly heal from a parasite or a fungal infection, each of your key biological systems and regulatory systems has to be evaluated for functionality. For example, if you've got a parasite infection, I've got to know how the function of your digestive system is, your detoxification and elimination systems. I've got to know how well your body is balanced for outflowing versus inflowing energy through movement. I got to know if your biological pump systems are working correctly. I need to know exquisite detail about your diet. I need to know about your sleep, lifestyle, habits. I need to know what your bowel movements look like and smell like, the frequency of them, and the list goes on. The limbic system's involved, how you process stress and emotion, your ideas, your beliefs. There's a lot of things that have to be looked at in order to identify where a person's got stress that they're usually thinking isn't connected to their parasite problem. Because our Western model of thinking, unfortunately, is far too left brain, disintegrative, treating the symptom as though it was the problem, treating the bug as though it was the problem, or the funguses. Funguses don't have any problems. They're doing exactly what they do. We have to look at the underlying factors. There's many environmental factors, such as excessive noise, excessive electromagnetic pollution, toxicity in the environment, water pollution, fault lines. I mean, the number of things that can be involved in creating stress for an individual that brings them down to 7 out of 10 or less. That's where the real trick is. That's why in my new Healing Fungal and Parasite Infections, the Absolute Essentials, I really put a lot of effort into showing you many things about parasites and about fungi and about how they work in nature and about what we're doing in our lives and how that sets us up for these problems, and about the lifestyle factors. And I teach people how to do an assessment on their overall life and set a series of core values in place based on their assessment of their own balance or imbalance using the methods I share. So it's essential. We're a system of codependent or interdependent systems. We're a cybernetic system, a system of systems. And each of these systems acts upon the other systems. So for example, if you're dehydrated, that can affect almost every single function in your body. If you drink caffeine, it winds up many systems and shuts some systems down. So if we don't look at which of these systems is involved in maintaining your health and check each one of them and look at the connection from one system to another system, you could have a disease over here in your digestive system, but your symptoms could be terrible skin problems, and you've been seeing dermatologists for years and seeing gastroenterologists for years who are probably doing all sorts of things, but you're not getting better. The point is, again, we're looking at the disease in your gut, not what you're doing every day to create it, such as having a mouth full of rotten teeth, which will infect your gut. So keep these factors in mind. How much more time have we got, Penny? Excuse me, I'm doing a time check. I've been out lifting rocks out in the wild, and I'm just all chewed up and gotten eaten up. I think some creatures made lunch out of me. Man, it must taste good because it's going at me. Okay, so let me just move on a little bit here and we'll finish. So that's that. I'm going to move on. Some of these I'm not going to read the whole thing. It's just too long. I'm just going to go to the highlighted section and give you the bullet points. I'm now fighting with a serious fungal infection all over my body. It's been 10 years. Comes back every time. I had it scraped, and they told me that it was nothing complicated. It's just a regular athlete's foot type of fungus. So she had this thing all over her body, an athlete's foot type fungus all over the place. Not uncommon. I already described, I've seen cases like that. What do? You do all the things I talked about in my program, and that's what you do. There's several factors that have to be looked at, as I've been sharing. But my point for you, my dear, I think it was, anyhow, my point is you can heal from it. Even if you failed many times. I have people come to me from all over the world that have failed 20 times, 30 times, have medical files 2 inches thick, 2 or 3 of them. And many, many times they were missing the absolutely most important things and had half their body parts cut out and the rest. Okay. Now, here's a good question. Angela, how important is it to identify the specific parasite that's causing the problem? Metametrics tests often come back with the taxonomy unavailable. Is there a more reliable way to determine what type of parasite is causing the issues? Now, there's several questions in this one little thing here. So the first one, how important is it to identify the specific parasite that's causing the problem? I think I alluded to that earlier. It can be important if a general approach doesn't kill it, doesn't wipe it out. Again, finding out what bug can be extremely helpful. It's, yes, it's anybody that has that information is a step ahead. But because of the problems I mentioned earlier with testing, you may not be able to find out. So sometimes you have to take different approaches. But people that have a lot of experience at treating parasites are quite good at knowing roughly what type of parasite it is by the symptoms and how you react to the different things that they give you at different times. Is there a more reliable way to determine what type of parasite is causing the issues? There are things you can do. I go through the method I use in the program and talk about things that you've got to look for and why using a log system and writing these things down is so important, because you have to look for cyclical patterns and other factors that I describe in the program. I honestly don't have to do that too often. I'd say 1 out of 10 maybe even 1 out of 15. Most of the time, by addressing the lifestyle factors and getting the vitality levels up, you don't have to go on these protracted type programs. You got to get the thing healthy enough first and then go from there. So my point is, if you get the lifestyle factors right and you follow the approach that I give in my program, you're probably not going to go through the tedious work to identify the exact parasite, because it won't be an issue anymore. But when patients aren't responding or they have more aggressive symptoms, then it gets to be an important factor, and it can be a serious one too. I've had 3 cases, I believe, of patients with tapeworms, and I had to get busy on those. The first one tricked me because I didn't know what it was. The second one, I was hip to it faster. Third one, no problem. Okay. What causes the body to be susceptible excuse me, to systemic fungal infections? How can you tell if an infection is systemic? Well, there's 2, excuse me. There's basically 2 types of fungal infection in my terminology. A superficial fungal infection is dandruff, jock itch, athlete's foot, toenail fungus, fingernail fungus, and some may consider a vaginal yeast infection deep. I would say that that's sitting on the border there, depending on opinion. So those are superficial fungal infections. Deep fungal infections are things that get inside of your body. If a fungus makes it through your gut wall, which is not uncommon, you will have a deep fungal infection. If the fungus gets into your bloodstream and can travel around, you can get a deep fungal infection. Your immune system has to protect you against that. If funguses get into joints, then you have a deep fungal infection. If funguses get into organs, you've got a deep fungal infection. Most deep fungal infections, in my observation, come from chronic stress, and it's usually preceded by a superficial fungal infection of some type. Those are my common observations. What causes the body to be susceptible to fungal infections is essentially excess stress and just not knowing what's happening, knowing how to handle it, and continuing to live in a way that facilitates the fungus. And now I'm going to throw you a neat little curveball. If you don't realize it's your lifestyle causing the fungal infection, and you go get medicines to treat the fungal infection, you can actually make yourself worse in the long run because the medicine is toxic to the body. And one of the problems with funguses is their cell type is so close to human beings, it's hard to make drugs that kill funguses without killing your own cells. So they're not easy things to get rid of. Also, funguses have another little trick up their sleeve. They can actually morph. Funguses can take on the body and the characteristics of a plant, and if you try to treat them with a drug that addresses them in that form, they then convert into something more akin to an animal and move. They literally will walk away from where you're applying the cream over time. So they're very, very crafty. Getting low on energy and having too much stress and all that, and then taking the medical drugs, and then having a die-off from the drugs all combined. So first you were tired and wired, then you were tired, wired, and drugged, then you were tired, wired, drugged, and had a potentially massive die-off. You can now open the door to so much more stress on your body and such a decrease in vitality, because the first thing that's going to happen is you're likely to not only have stress, fatigue from your liver being worked, but you're very likely to have a massive die-off, and that massive die-off is very likely to activate your immune system and make you tired and sleepy and lethargic. And most people reach right for cough medicines, stimulants, coffee, tea, sugar, anything to drag their worse by repeatedly treating these things and not addressing the most common causes, which is why I called it the absolute essentials. So I think that pretty much gives you enough working information to start with. If I didn't answer the question, how can you tell if the infection is systemic? It's because you have symptoms internally, such as painful popping joints, joints that won't hold their proper position and they sublux, and you constantly have to pop yourself or get a chiropractor or an osteopath to manipulate you. Digestive and eliminative trouble, leaky gut problems can come from funguses. Autonomic dysregulation, blood sugar handling problems, blood pressure handling problems, bowel movement problems, urinary problems, piddling urine, feeling like you got to pee all the time, feeling like you can't empty your bladder, like I said, vaginal yeast infections. Those are all potentially symptoms of a deep fungal infection or a systemic fungal infection. And I know what it's like because I have one. I had a serious fungal infection when I was a kid. Nobody knew what was wrong with me. To make a long story short, I lived on an antifungal diet, like a serious antifungal diet for probably a couple of years before I began to get a little looser. But as I've gotten healthier and healthier and decreased stress in my life and been more consistent with my Tai Chi over the years, I've been able to manage it quite effectively, but there's just certain things I can't get away with. Like I can, you know, if you give me one Girl Scout cookie with icing on it or sugar on it, I can get quite a buzz from that and start itching all over the place because it'll activate the fungus that are stuck inside my body and seem to like it there. But I would like to close by saying I actually have found that fungal infections and parasite infections can be quite a blessing because they're very good teachers. You eat too much of the wrong thing and they make you itch, they give you bad symptoms, they get you gassy and bloaty, and there's no question about what it is that you're doing to make yourself worse. And the truth of the matter is, most of my patients know what they're doing wrong, but they don't want to stop doing it because it's related to somehow being a comfort food or an activity that they perceive decreases their stress levels, which in some ways could be considered a potential addiction. For example, if you can't start your morning without a cup of coffee, even if you're only drinking one coffee, that's an addiction. So I think that's good enough for tonight. That's the basics, and hope you enjoy the program. I put my heart and soul into that thing, and the whole staff did. Daryl did a great job editing it. A lot of work and preparation. In the program, I do a recap or a whole section on the key points, learning points, and I add some special information in that isn't in the body of the program. I think you'll all be really pleased and get great results, and my dream is that you'll all be vital and not spend unnecessary money on doctors and therapists that you could be spending on, you know, grass-fed, free-range animals and good quality organic food and nice vacations somewhere. So thanks for joining me tonight. What the hell is that?